The Dr. Fazil TV show is brought to you by POYA, People of Yuma Health Association. The Dr. Fazil TV show is intended for health educational purposes only and complies with all the HIPAA regulations.
Good afternoon and welcome to the Dr. Fazil Show. This is our September 2020 edition. We have Dr. Fazil with us this afternoon, and he's going to be educating us on the COVID-19 vaccine and where the progress is going.
Thank you, Wendy, for having me here today. So the topic of discussion, as I understand, is and updates on the vaccine for COVID-19 infection.
Yes.
So let's start the discussion on that, and let me or our audience need to know what's the update on the COVID-19 vaccine, and should they have it, or when they should expect it, and any side effect there might be, and what's going on. So that's what my goal is, to inform and educate our audience today about the COVID-19 vaccine.
Thank you very much. Dr. Fazil, what's the difference between a vaccine and a cure for the coronavirus?
So the difference between vaccine is that it's more of a preventive measure as compared to the cure. The cure is when somebody already got infection and we're trying to control the infection, while vaccine is where you're actively inoculating a person to prevent that infection to happen before it happens.
And how long does it take to come up with a vaccine?
It depends. I mean, historically it takes many years, a few years, maybe 2 to 3 years, because the vaccine process is a lengthy process. And the reason is that vaccine is being given to healthy people. So this, we have to be careful not to give the vaccine to healthy people and make them sicker than they would have been without the vaccine, and they might never get an infection in the first place. So that's why development of vaccine and inoculation is a very lengthy and rigorous process. Generally, it goes through 3 different trials. We call it phase 1, phase 2, and phase 3. In phase 1, few dozen of people are used in trial to see if there's any major side effect of the vaccine, and if the vaccine is effective or not. In phase 2, hundreds of people are used, and then different demographics are used to see if the vaccine is effective for all kind of demographics: children, male, female, different ethnicities. In phase 3, thousands of people are used, but in phase 3, generally they use placebo as well. That means it's a double-blind study in which half of people wouldn't get real vaccine and half would get vaccine, and they will see there's no bias in the study, and then over a period of time they will see if the vaccine has worked on those people who got the vaccine, and if there was any major side effects which will cause major issues down the road if the vaccine is used on millions of people, especially with COVID-19, which is a pandemic, and then we're talking about billions of people for vaccination. So typically that's a historical way of doing things. But in COVID-19 case, since it seems like more of an urgent situation, we're going in a fast track mode, and we are in phase 3 trial at this time. There are 2 companies which are actually doing vaccination. There are 2 companies, Moderna and Pfizer, which are actually being selected to make vaccine in the U.S. market, and they should be. We don't know when the vaccine would be available, but as this moment we know they're already in phase 3 trial phase.
And where do we stand as the United States in regards to other countries as far as a vaccine? Is it a worldwide vaccine, or is it country by country?
Well, at this point, each country is doing their own thing. Pfizer is a global company. Obviously, they're going to be helping other countries as well. But I know, like Russia have already done, actually they've bypassed phase 3 trial, and they already have gone to the active mode. Their vaccine has been being used so far. The priority was high-risk profession, the first responders. They're being inoculated in Russia, So far, they have not got any major side effects reported. So it seems like their version of vaccine is working. Although what they're using is a live vaccine versus what we're going to use here is going to be, I will say, inactivated vaccine or synthetic vaccine. So in the Russian version of vaccine, they have used adenovirus virus, which is normally cause mild cold, and they have injected or inoculated that virus with a certain kind of protein known as spike protein, which is actually part of the coronavirus. And if you look at the coronavirus pictures, you can see the little spikes on it. That's why that's why we call it coronavirus. It looks like a crown, and that's injected inside the adenovirus, which is injected inside the patient. The human body reacts to that virus as it is a COVID-19 infection and makes antibodies, and that's the Russian version at this time. And so far, we haven't heard any bad side effects, but I think we'll have to see at a bigger level when a lot of people get inoculated to see if there's any side effects and what the real efficacy of the vaccine is.
Thank you. Do you know approximately how long or when we should anticipate seeing a vaccine in the United States?
Again, we are in phase 3 trial. I mean, what we are hearing is it could be available for limited people in maybe November 2nd or somewhere at the start of November of this year. And after that, it will be slowly used in general population after the reaction from the first phase of the inoculation in high-risk individuals, and if they are doing okay and if they have adequate antibody response and they have no side effects, then it would be available by end of this year to general population as well. That's a estimate at this time. Obviously, we don't know if there's any unknown factors which might be at this time, but this is based on projection at this time.
Okay. And Dr. Fazil, if the vaccine from Russia is tested out and is safe, would that be available to the United States as well?
Actually, in the United States, Moderna and Pfizer, they have used a different technology. They have never used it before. What they have done is they have used something known as messenger RNA, which is kind of like part of the COVID-19 virus, and they use that messenger RNA, then inject directly into the human body in the muscle. That messenger RNA tell muscles to produce antibodies against the COVID-19. So there's no virus involved in this version. This is directly messenger RNA is like a code which tells the cells to make certain kind of proteins. So instead of inoculating a protein in the body, we're actually sending a code, a genetic code inside the human being that will tell the cells to produce antibodies, which will generate human beings to produce antibodies against the COVID-19 infection. So this is a novel technology, but it has been successfully tested in phase 1 and phase 2 trials. So we'll have to see in phase 3 trials that if it works, then it is actually a better version, less side effects than the Russian version, because this is not a live virus vaccine. It is just it's not even a protein, it's actually a messenger RNA. So I think we are taking more time because this is a more safer version than the Russian vaccine.
So there is light at the end of the tunnel, so to speak, as far as this virus is concerned.
Yes, and as I said, the United States have been very. The United States is a very powerful country. It has won 2 world wars, and this is also like a big war we have to win, and we will win, and it is just a matter of time. And with the technology we have and the determination we have, we will prevail at the end of the day.
Great. Let's hope we're all right on that one. Are there any side effects of the current vaccine that's being tested?
Yes, so there's some side effect which has been noticed so far. That includes mild fever, headache, joint pains, But pretty much that's it for now. And they are very they are for short duration period of time, just like any other vaccine. Like in flu vaccine, we see the same side effects. Similar side effect profile has been seen with these vaccines. So I think the risk is far more less than the benefit for having this vaccine.
And are they testing the COVID-19 vaccine against the flu vaccine to see if there's any interaction between the two of those?
Well, the flu vaccine is again, as we have seen in other cases, that you can have multiple vaccine, like pneumonia vaccine and flu vaccine. So there's no interaction between one vaccine or the other vaccine. But this year, since we are expecting the COVID-19 vaccine to be available by the end of this year, and that's the time when we do the flu vaccine as well. And the reason they want to split two vaccines is just for the side effect. So you don't want to have two vaccines at the same time and have a very bad headache or very bad fever because you got reaction from two vaccines. So that's why actually generally we start doing flu vaccination in month of October every year, but this year we started in September. So I do recommend everybody to get their flu vaccine this year rather early, so when the COVID-19 vaccine become available, they should be ready for that and not having both vaccines at the same time.
Thank you. Dr. Fazil, as far as the vaccine goes for the COVID-19, there's been mixed emotions and mixed reports back and forth on that. What would you recommend as far as that vaccine goes?
Well, I know there's some concern that we're going too fast and the vaccine might have more side effects, and they might not be obvious yet because we are, as we said, we are going in a fast track mode, and other vaccines generally take years to develop and test, and this time we are not doing it. And the question is, should we wait and see how it goes versus be the early adapters? I'll leave it up to the individuals. I guess everybody have a choice to make. Medical opinion wise, I think the risk is less than the benefit. The benefit is more because it has shut down the economies. It is causing a lot of fatalities. The estimated loss of lives in the US alone by end of this year is around 400,000 people. So I think if COVID-19 vaccine become available, we should go ahead and use it and get back on the track. I will take it personally myself.
Okay, that puts us all at ease there. Thank you, Dr. Fazil, for helping educate us and inform us of the steps that they're taking for this COVID-19 vaccination. And this concludes our segment for the month of September 2020. And please stay tuned with us for next month's edition of the Dr. Fazil Show for October 2020.
Thank you so much for our audience to watch this show, and be safe and protect yourself. And as I just have to mention that none of us is using masks right now because we are in isolation and not in proximity to anybody else in this show at this time. So, but I do want to make sure that we should all wear the mask, and I'm not wearing the mask because I'm not in proximity to anybody at this time. Be safe, and we'll get this pandemic under control very soon. Thank you so much.
Thank you.